Question: what is the significance of testicular hematoma in testicular injury? Answer: testicular hematoma can occur due to bleeding within the testicular tissue. Timely intervention is necessary to prevent complications. Question: how can the risk of testicular torsion be managed after testicular injury repair? Answer: in cases where testicular torsion is ruled out, vigilant monitoring for signs of recurrence or ongoing torsion is necessary after testicular injury repair. Question: what is the role of testicular fixation in managing recurrent testicular torsion? Answer: testicular fixation, also known as orchiopexy, involves securing the testes to prevent future torsion episodes and is used in managing recurrent testicular torsion. Question: how can the risk of hydrocele formation be managed after testicular injury? Answer: regular surveillance and interventions such as hydrocelectomy help manage hydrocele formation that may develop after testicular injury. Question: what is the significance of epididymitis in testicular injury? Answer: epididymitis, inflammation of the epididymis, can develop as a complication of testicular injury. Treatment includes antibiotics and anti-inflammatory medications. Question: how can the risk of testicular infection be managed after testicular injury? Answer: administering antibiotics, maintaining proper wound care, and addressing any signs of infection promptly help manage the risk of testicular infection after injury. Question: what is the role of testosterone replacement therapy in managing testicular injury? Answer: testosterone replacement therapy may be considered in cases of severe testicular injury leading to hormonal dysfunction and low testosterone levels. Question: what are the common causes of testicular injury? Answer: testicular injury can result from blunt trauma, sports-related injuries, accidents, falls, and other trauma to the scrotal area. Question: how is testicular injury severity assessed? Answer: testicular injury severity is often assessed based on clinical presentation, physical examination findings, and imaging studies such as ultrasound. Question: what are the clinical signs and symptoms of testicular injury? Answer: clinical signs of testicular injury may include severe scrotal pain, swelling, bruising, tenderness, and sometimes blood in the scrotum. Question: how can testicular torsion be differentiated from other testicular injuries? Answer: testicular torsion is characterized by sudden onset severe testicular pain, absent cremasteric reflex, and often nausea and vomiting. It requires urgent surgical intervention. Question: what imaging studies are commonly used to diagnose testicular injury? Answer: ultrasound is the primary imaging modality used to diagnose testicular injury, assess the extent of damage, and rule out conditions like testicular torsion. Question: what is the initial management approach for a patient with suspected testicular injury? Answer: the initial management approach includes pain management, elevation of the scrotum, application of ice, and diagnostic evaluation with ultrasound. Question: what is the primary concern in managing testicular injury? Answer: the primary concern in managing testicular injury is preserving testicular function, preventing infection, and minimizing the risk of subsequent complications. Question: how does the management approach differ between minor and severe testicular injuries? Answer: minor testicular injuries may be managed conservatively with pain control and close observation. Severe injuries with rupture or significant damage may require surgical intervention. Question: what are the indications for surgical exploration in testicular injury? Answer: indications for surgical exploration in testicular injury include suspected testicular rupture, significant hematoma, or evidence of vascular compromise. Question: how is testicular rupture managed surgically? Answer: testicular rupture is managed surgically by repairing the rupture and preserving as much viable testicular tissue as possible to ensure testicular function. Question: what is the role of scrotal exploration in managing testicular injury? Answer: Scrotal exploration allows direct visualization of the testes, assessment of the extent of injury, and repair of damaged structures if necessary. Question: how can the risk of infection be minimized in testicular injury management? Answer: administering antibiotics, practicing meticulous surgical technique, maintaining sterile conditions, and effective wound care help minimize the risk of infection in testicular injury management. Question: what is the role of scrotal support in managing testicular injury? Answer: scrotal support with supportive underwear or a scrotal sling can help reduce pain and swelling in patients with testicular injuries. Question: how can the risk of testicular atrophy be managed after testicular injury? Answer: regular surveillance and interventions such as hormone replacement therapy or surgical interventions help manage testicular atrophy that may develop after injury. Question: how can the risk of delayed testicular ischemia be managed after testicular injury? Answer: regular surveillance and interventions such as exploration and repair help manage the risk of delayed testicular ischemia that may develop after injury. Question: what is the significance of testicular dysfunction in delayed complications of testicular injury? Answer: testicular dysfunction, characterized by hormonal imbalances and impaired fertility, can develop as a delayed complication of testicular injury. Monitoring and interventions are important. Question: how can the risk of postoperative hematoma be managed after surgical repair of testicular injury? Answer: adequate hemostasis, meticulous surgical technique, and proper wound care help manage the risk of postoperative hematoma after surgical repair of testicular injury. Question: what is the role of scrotal exploration in managing testicular torsion? Answer: scrotal exploration is performed urgently in cases of suspected testicular torsion to detorse the testes, assessing viability, and prevent permanent damage. Question: how can the risk of testicular necrosis be managed during surgical repair? Answer: timely surgical intervention, minimizing ischemia time, and ensuring adequate blood supply help manage the risk of testicular necrosis during repair. Question: what is the significance of testicular abscess in testicular injury? Answer: testicular abscess can develop as a rare complication of infection or delayed treatment in testicular injury cases. Drainage and antibiotics are typically required. Question: how can the risk of postoperative scrotal hematoma be managed after surgical repair of testicular injury? Answer: adequate hemostasis, proper wound closure, and postoperative scrotal support help manage the risk of postoperative scrotal hematoma after surgical repair. Question: what is the role of imaging studies in evaluating testicular injury? Answer: imaging studies such as ultrasound are used to confirm the diagnosis, assess the extent of injury, and rule out other conditions like testicular torsion. Question: how can the risk of testicular dysfunction be managed after testicular injury? Answer: regular hormonal monitoring, appropriate interventions, and counseling on fertility preservation help manage the risk of testicular dysfunction after injury. Question: what is the significance of delayed testicular torsion in testicular injury? Answer: delayed testicular torsion can occur after initial trauma, leading to impaired blood supply and testicular damage. Early recognition and surgical intervention are crucial. Question: how can the risk of psychological distress be managed after testicular injury? Answer: providing psychological support, counseling, and education about the injury and potential outcomes help manage the risk of psychological distress after testicular injury. Question: what is the role of follow-up visits in managing testicular injury? Answer: regular follow-up visits allow monitoring of healing progress, detection of complications, and adjustment of treatment plans as needed. Question: how can the risk of chronic pain be managed after testicular injury? Answer: addressing pain management, identifying underlying causes, and offering supportive therapies help manage the risk of chronic pain after testicular injury. Question: What is the significance of hematoma infection in testicular injury? Answer. Hematoma infection can develop as a complication of untreated hematoma in testicular injury cases. Timely drainage and antibiotics are essential. Question. How can the risk of recurrent infection be managed after testicular injury repair? Answer. Administering antibiotics, maintaining proper wound care, and addressing any signs of infection promptly help manage the risk of recurrent infection after injury repair. Question. What is the role of protective equipment in preventing testicular injury? Answer. Wearing appropriate protective equipment during sports and activities can significantly reduce the risk of testicular injury. Question. How can the risk of secondary torsion be managed after testicular injury? Answer. Educating patients about the risk of secondary torsion, promoting scrotal support, and emphasizing prompt medical attention for any recurrent symptoms help manage this risk. Question. What is the significance of hematocele in testicular injury? Answer. Hematocele, accumulation of blood within the tunica, can develop as a complication of testicular injury. Intervention is needed if it causes discomfort or complications. Question. How can the risk of testicular injury be minimized in athletic activities? Answer. Wearing appropriate protective gear, practicing safe techniques, and following sports rules and guidelines help minimize the risk of testicular injury in athletic activities.